You just got the call that you have been dreading your entire career. A family wants your help with their son who has a diagnosis you have no idea what to do with and you've never dealt with before. Dissociative identity disorder. What? Is that multiple personality disorder? Is that really a thing? Can family therapy even help with that? The answer is yes to all of the above. And in this video, we'll walk through a Minuchin structural family therapy case study so you can see how a family systems therapist would handle it all. Now, you might be thinking, okay, that's a bit unusual, and this is probably an individual therapy case, a psychiatry case even, maybe even a neurology case. But I want to make the argument today that if you put your systemic glasses on, which if you've been around this channel for more than 5 minutes, you know it's my favorite thing to do, this case is actually a textbook example of a family problem wearing a very dramatic disguise. But if we haven't met before, my name is Oliver and I'm a couples and family therapist here in Los Angeles. I love family systems, I love structural family therapy, and I love taking a case that looks completely overwhelming and showing you that there is actually a systemic map through it. Now, if you're interested in more family systems trainings and videos, there is Family Systems Step by Step, an online course that I built. And even more exciting, I'm building an online family systems therapy community, and I would love for you to be part of it. There'll be live Q&As, case consultation, trainings, and so much more. Sign up to be the first to hear about it using the link below. Plus, you'll also get the handouts and PDFs to go along with this video. I'll make sure the link is below. So today we're looking at a case that is not technically a real family, but it is based on a real situation. And the IP is an 18-year-old male that has been diagnosed with dissociative identity disorder, or DID, and his family have been referred for structural family therapy after a recent hospitalization. The first step in my family systems step-by-step course is to collect data, and that starts before you even meet the family during the intake call, in which we learn that we've got a family of 3. Ronnie, who is the IP, our identified patient, and his 2 parents. So in the consultation call, you'll get the basics. Who's in the family? How old are they? What's the presenting problem or diagnosis that you're dealing with? But you can also get more information, namely, who called you? In this family, it was mum, which may flag her as potentially being an overfunctioner or perhaps the emotional manager of the family. She references that dad's schedule is a factor on whether they can make it, which might position him as being more in power or being the leader. But he wasn't the one who picked up the phone, and that is worth noting. And the big one is the presenting problem, which from the family's perspective and the hospital's perspective is that Ronnie has DID and he has an alter ego that he calls Data, which is described as being a robot, an android, and his parents just wanted him to stop doing that. Before we go any further though, I want to take a quick detour and explain what DID is, because it's one of those diagnoses that gets thrown around a lot, usually by any teenager that's got a TikTok account, but it does deserve a bit of a reality check. First of all, can we say it properly? Dissociate, not disassociate. The number of professionals that add an extra syllable to this is baffling to me. Dissociative identity disorder is a subtype of dissociative disorders, which at its basic is a disruption in a person's sense of identity, memory, or sense of self. The identity part of DID means that a person develops what feels like a separate identity, a distinct way of being that can emerge and take control. And the bit that's really relevant for us as systemic thinkers is DID doesn't tend to show up out of nowhere. It is actually strongly correlated with early experiences of emotional rejection, neglect, inconsistent parenting, and this is the one that gets me, modeling of dissociation by caregivers. In other words, a child who grows up watching a parent or a caregiver check out emotionally as a way of coping with stress, learns that checking out is what you do when things get hard. And that is exactly what we're going to see in this case. So what the family says is the problem is that he does this thing, and if he could stop doing that thing, life would be better. That is a very linear way of looking at it, and I completely understand the thinking. But if you think systemically, we have to ask, what is this symptom doing for the family? Because symptoms, as I always say, don't just happen to people, they happen in relationships. So our first job is to really understand and assess the family and all of the relationships. So let's fast forward to that first session and I'll tell you what I pay attention to in order to collect all of this data. First of all, who walks into the room first? Now, clearly this doesn't apply all of the time and it depends on the setup to your office, but pay attention to who comes in first. In this scenario, Dad walks in first and he tells everyone where to sit. For me, that's quite telling. Perhaps it reinforces his status as the CEO of the family, but I'm also paying attention to where people sit. And in this family, Mum positions herself next to Ronnie on one sofa and Dad sits opposite me. Again, I'm just collecting the data. There's no judgment. It doesn't mean anything yet. I'm just noting it though. I'm using circular questioning and there's a whole video series on that to get information about a couple of things: power and communication. We want to pay attention to who leads the conversation. And Dad starts taking control, sharing the narrative. But whenever that happens, I'd also keep an eye out to the other parent or other family members, whether Mum, in this case, quietly redirects or softens what Dad says. You're looking for little covert power plays that undermine or reinforce each other. In this family, Dad determines what the family is allowed to talk about. Disappointment, emotional needs, marital distance are all off the table. Mum seems to keep the peace by not voicing her needs directly, and Ronnie has no sort of voice at all. I'm looking for discipline and nurturance. How much warmth comes from Dad and Mum? How much warmth comes from Dad to Ronnie when he's in crisis? I'm looking for differences. When is somebody nice and warm and loving, and when are they harsh and mean? What differences are there? When does one way of parenting exist and another doesn't? I'm also looking for subsystems and boundaries. So I notice immediately that Mum and Ronnie are mirroring each other's body language. They're sitting on the same sofa. That's probably a sign that there's a porous boundary showing up in the room before really we've got into the main content. So what do we do with all of this information? Well, before we go there, let's get structural for a minute and let me give you my comparison to a family and a company. It works. It's just an analogy, but you'll get it. So in a healthy organization, the CEO runs the show. They set the vision, they make the big calls. Underneath them, people have roles, departments, responsibilities. But there are very clear boundaries between what the CEO does and what an intern does. The critical thing here is that good CEOs listen to feedback. They want to know when something is working and when it isn't. A good CEO won't fire you for having a different opinion. They're also going to support you and nurture you with money, your paycheck, maybe a laptop, maybe benefits. And ideally, you like the boss so much you want to stay and, more importantly, do a good job so you don't get fired. Now imagine a CEO who does not listen or doesn't give you any of those benefits. Imagine a CEO who responds to any sign of disagreement with hostility and disappointment. What would employees beneath them do? Well, first of all, they stop giving feedback, they stop being honest, they don't work as hard, and ultimately they're going to find a new job. The point is, a good, well-functioning organization has happy employees that do their job and reach the company's goal. When a company is disorganized, badly organized, or badly run, it doesn't work so well. And that is the situation with Ronnie and his family. Dad is the CEO of this family and nobody disputes that, but the communication is only one way. Ronnie can't disagree, he can't push back, he can't assert himself as an 18-year-old. Potentially he might have found a workaround and outsources the confrontation to Data, the android. And Data, it turns out, can say all of the things that Ronnie cannot. So at this point, you know I have to make a visual, and if you've bought Family Systems step by step, you've seen that I'm a little bit obsessed with family maps. For everyone else, here's the quick rundown. Family maps are just a way of representing all of the information that we've talked about and gathered so far visually. We use squares to represent family members, and we place people with more power or influence at the top, just like an organization chart. In a healthy family, we've normally got two parents at the top with a clear, healthy boundary separating them from the children below. In Ronnie's family map, that looks quite different from this ideal. So I'm going to walk you through each relationship because there's a lot going on. But before, we're going to apply what I've learned from my observations in the first sessions about the individuals. Dad is unquestionably the head of the household. He's dominant, he's critical, he's the primary decision maker. When he has an expectation and Ronnie doesn't meet it, the response is not curiosity or support, it's criticism and hostility. Dad's parenting style could be described as high pressure and low warmth, which is not a particularly good recipe for having a kid who grows up feeling safe enough to take risks or make mistakes or even become themselves fully. Mum is warm and loving. On the surface, that sounds great, but she has her own way of dealing with conflicts in her marriage, and that way is to check out. She emotionally withdraws and, in fact, dissociates in some ways, and Ronnie has been watching that his entire life. And then let's talk about Ronnie for a little bit. During the 3 months prior to his hospitalization, he had reported difficulty in concentrating, feeling sad and helpless. He was observed muttering to himself and had increasingly poor self-care. There were a lot of anger outbursts directed to his parents, specifically Dad. The main presenting problem that we uncover in this first session is the sensation he describes as if his body being taken over by another person that he called Data. And Data seems to appear whenever he felt criticized or attacked by his father, or whenever disappointment was articulated by Dad. So let's go into the relationships. Between Dad and Ronnie, there's distance and conflict. So this relationship has a rigid boundary between them. It's rigid in the sense that there's no real exchange happening. Dad pushes his expectations and communications one way downwards, and Ronnie can't push back. The communication is one directional, which means it's not really communication. But when Ronnie fails to meet Dad's expectations, which he inevitably does, the response is criticism and hostility, which then triggers this dissociation, and that actually triggers a very different response from Dad that we'll get to in a minute. Mum and Ronnie are like the other side of the coin. The boundary is not at all rigid. It's the complete opposite. It's porous. They are too close, too blurred. Mum's kind of stepped into a role where she's the emotional support system to her son, but also kind of like a partner too. She's met his emotional needs in a way that Dad doesn't. She's available and present, but that means that Ronnie's come to rely on her for emotional regulation in a way that has prevented him from developing his own ways to regulate, and that's enmeshment. It's one of the more important things on the family map. You can see how the family map kind of mirrors the setup and where people sat in the office. We can't forget the couple. And this is where it gets interesting, because what's happening between Mum and Dad is not really being addressed by anyone, not them as a couple, and certainly not by other treatment providers. Dad expects Mum to carry out her roles without voicing an opinion. It's not an equal partnership at all. Mum wants more closeness, more emotional connection, and she's not getting it from her husband, so she might have turned towards her son instead. And Dad, who is already emotionally unavailable, at the best of times, is now increasingly on the outside, in a conflicting relationship with Ronnie and a strained one with his wife. So what we have here is a cross-generational coalition. Mum and Ronnie together in a kind of unofficial alliance against Dad, not necessarily out of malice or anything mean, but because neither of them has any other way of managing the situation and the relationship. This is textbook structural family therapy territory. When you've got a parent and a child aligned against the other parent, you've got a family that's organizing itself in a way that's going to cause someone to develop symptoms, and in this case, that someone is Ronnie. So I created the family map based on a lot of observational data and from the circular questioning, and now I want to run this through my hypothesis generator, which you'll know is how I organize everything I've gathered. There's 5 categories: problem, process, proximity, power, and patterns. Let's get into it. So the problem on the surface is pretty clear. Ronnie dissociates into an alternate identity he calls Data. He also has these angry outbursts. He's withdrawn and he's not taking care of himself for the 3 months leading up to the hospitalization. The family and hospital have identified Ronnie as having the problem, but systemically, the real question is, what is this symptom doing? What job is it performing in this family? In my mind, it's doing several jobs at once, and that's what makes this so sticky and tricky. Process is where the case gets really juicy. What happens in the family? Dad is dominant and critical. The unspoken rule of this family is conform to Dad's expectations or deal with his disapproval. Nobody talks about what that feels like. It feels a bit controlling, authoritarian maybe, but there is no process for Ronnie to express individuality, disagreement, or emotional pain directly, especially to Dad. Meanwhile, Mom is coping with the marital tension by checking out, by dissociating herself. She's modeling to Ronnie, entirely unconsciously, of course, that when things get too painful, you leave the room, psychologically speaking. And Ronnie's learned this lesson really well and seems to be repeating it. Proximity. So as you can see on the family map, Mum and Ronnie are too close. Dad and Ronnie are too distant and conflictual. And Mum and Dad are emotionally disconnected from each other. The proximity in this family is completely off balance. And because nobody's addressed these gaps between all of the different people, Ronnie's stepped into it. Or Data has stepped into it, right? Without anyone realizing it, he's Mum's emotional anchor and also plays this mitigating role between him and Dad. He's an 18-year-old who's still trying to figure out who he is and doesn't have the space to do it. Power on the surface is all about Dad, right? He's the unquestioned authority, the decision maker, the patriarch. But what I come back to in these cases is that appearances can be deceiving because Ronnie, despite looking completely powerless, has actually found a really nifty way to get power back through his symptoms. The detail that left off the page at me is when Data appears, Dad's behavior changes. So during and after the dissociative episodes, Dad actually becomes very affectionate, attentive, warm. That is in complete contrast to the way he behaves during normal interactions with Ronnie. So Ronnie's getting a form of paternal warmth, the only version available to him, but only through his symptoms. The dissociation is essentially the only lever Ronnie has to shift the power dynamic with his father, even if it's just temporary. So if you can understand the function of the symptom, you get to see why it makes sense. You also get to see why the symptoms persist. Mum also holds a kind of covert power in this system because she manages the emotional temperature of the family in ways Dad probably doesn't fully see. She's got this implicit coalition with Ronnie that gives her a kind of influence that she doesn't have directly in a marriage. She gets some form of power or soothing by ganging up with Ronnie. Patterns. This is the cycle. So follow it with me because it's a beautiful clinical example, really. Dad criticizes Ronnie or expresses disappointment. Ronnie cannot assert himself directly. Confrontation is not permitted in this family. So Ronnie dissociates into Data. And Data is the one that can confront Dad. Data can do what Ronnie can't. Dad then becomes affectionate and attentive in response to this crisis. Mum's drawn closer to Ronnie and to her husband. But when things get back to normal, Data eventually goes away. Then Dad's expectations and critical stance returns. And then we're back to step one. So this is a perfectly organized cycle. It's just organized in such a way that it's keeping everyone stuck and the symptom persisting. So I'm always asking, what is the symptom doing? What job is it performing? And in this case, the symptom is doing maybe 4 jobs simultaneously, which may explain why it's not going away, right? First of all, it's protective. The dissociation shields Ronnie from the full emotional impact of his father's rejection. When pain or discomfort or criticism gets too big, he leaves the room psychologically. Second, it's a communication. Data is able to say the things that Ronnie can't say within the family's normal rules. It's the only character in this system who's allowed to confront Dad. And in a family where honest communication has never really been safe, Data's the one who gets to tell the truth. Number 3, it's a relationship architect, right? It rearranges the furniture in the room. The dissociation pulls Dad closer temporarily in the only way that Ronnie knows how to access paternal warmth, which is really heartbreaking when you think about it. This teenager's found a way to make his father soften. It just happens to be a psychiatric crisis. And number 4, it's a family stabilizer. When Ronnie is in crisis, Mum and Dad have something to organize around together. It brings them closer. The focus goes to the kid. The distance between the married couple gets smaller. They feel closer and more connected. And you will see this over and over again in families. All right, so the interventions, where do we go from here? Well, the family maps show us what to do, right? We know that We've got an ideal version of this family and a version of the family that we're currently seeing. So we need to get them from A to B. Structural family therapists often start with a reframe, right? The family currently sees Ronnie as the problem, and any good structural family therapist knows that that is where we have to start, not by agreeing with that framing, by gently, carefully dismantling the opinion, the linear example that the family came in telling us about. A reframe might sound something like this. I can see how genuinely terrifying it must be to watch your son go through this and the hospitalization, and I want to help you understand it in a way that gives us somewhere to go. I wonder if it's possible that you can see that Ronnie has been trying really hard to be the son that you both want him to be, and that data is the part of him that's been protecting the family from having very difficult conversations. It seems to me that Ronnie's found a way to tell you what he needs, and that is for this family to be closer. The other version of him, data, has stepped in to do this, and it's misguided and it's terrifying, but in a strange way, this whole process might be a really courageous act of love. Suggesting that DID is fabricated or that Ronnie is choosing this, I'm saying that the symptoms don't appear in a vacuum. And if we can help the family see that this is a relationship problem, a family problem, not a fix my kid problem, we get buy-in, and then we have a chance to make real change. Number 2, separate the couple's issues from Ronnie's issues. I would really want to start strengthening the couple subsystem, because right now, Ronnie is the glue that holds mum and dad together in any kind of functional relationship. When he is in crisis, they co-parent really effectively, but when he's not, there's a huge amount of distance. So we've got to help mum and dad build a direct, closer relationship and connection with each other. And I've got to help dad understand that his emotional unavailability to his wife and son is part of the story. The symptoms aren't going anywhere unless that changes. So I'd want to work on couple communication, getting them to use I statements, getting dad to slow down and listen rather than react, mum to advocate what she needs in the marriage rather than turning to Ronnie. And again, this isn't about blaming mum and dad. It's about showing them what happens between the two of them is absolutely relevant to what's happening with their son. The big one, though, is tackling dad's parenting style very carefully and very cautiously, but dad has got to change, right? I'm going to be kind of direct about that, but you can't walk into a first session with this alpha dominant critical patriarch and say your parenting is the problem. You will lose him in the first 5 minutes and you'll never get him back. So lots of joining with dad at first, but then you do need to confront him. I'd come at it through a reframe and talk about Ronnie's need for individuation. His developmental needs at 18 are that he's got to be making his own choices about his career and his friendships and his hobbies. So I'd position dad's parenting as being supportive of Ronnie being an individual, because what dad wants ultimately is a son who's successful and capable and functioning in the world. And the path to that is not more pressure or criticism, it's more safety. A teenager who is unafraid to fail will try new things, right? But a teenager who is terrified of dad's criticism or disapproval won't. I've got to reduce the secondary gains, right? This is important and easy to overlook, but if dissociation is the only way Ronnie gets paternal warmth, we need to create other pathways for that. That means educating dad gently and again without blame about the fact that when he becomes affectionate and attentive during and after these dissociative episodes, he's reinforcing the thing that he wants to stop. The goal, though, is not to take that away, but actually to make warmth and connection available to Ronnie, not as a reward for data coming out. That means dad has to start practicing a very different way of showing up and connecting with his kid. I think the other one is I've got to help Ronnie individuate. Ronnie's got a lot of individual work to do alongside the family work. I've got to help him focus on developing the capacity to be himself, gain more psychological autonomy, assertiveness training, coping skills, things that don't involve him checking out, and gradually taking on more independence, household responsibilities, small decisions, so that he can individuate in a way that's supported, boundaried, rather than exploding out of him when data takes over. Data exists because Ronnie can't. So the goal of therapy is to make space for Ronnie, not to suppress data, but to give Ronnie enough safety and skills that data isn't needed anymore. Okay, so that is my take on this case. And what I find so fascinating about it is how it clearly illustrates something that I say all of the time. The most dramatic symptoms are often the most eloquent, right? Data isn't an accident. Data is a solution, a very disruptive, scary one to a problem that nobody in this family had language for. If you're working with families or if you're seeing individual clients who seem to have symptoms that make more sense in perspective of their relationship, I hope this has been useful to you. Structural family therapy is hard work, but it does give you a map, and maps make all the difference when you're working with complex cases and multiple people in the room. If you want to go deeper on family maps, the hypothesis generator, circular questioning, and all of the tools I use with families, including the tricky stuff like working with parents, they're all in my Family Systems step-by-step course. It's available now, and I'll put the link below. And you can also sign up to be the first to know about my online Family Systems community, which I'm very excited about. So do all of the things. Hit the like, the subscribe, the share, all of the buttons, please. That would be great. More importantly, share this with someone you know who might want to learn a bit about structural family therapy or working with families. Until the next time.